Hello, I'm Dr. Dennis McKenna. Welcome to another edition of Inside Albany Med. And I'm so pleased today to be joined by Mr. Charles O'Donnell. Charles, it's great to have you here.
Thank you very much, sir. I really appreciate being here, and it's an honor. Thank you.
Well, we've been looking forward to this for a while. You are someone who I've wanted to sit down with, talk to. Like many of the people who sit in this chair, you're somebody who most of the hospital knows in some capacity. But we're going to dive into that a little bit. So let's start with the basics. You are a nurse clinician.
Correct. I'm a nurse clinician, and I technically belong to E2, but Albany Med had recruited me about 14 or 15 years ago, and part of that arrangement was that I belong to the hospital.
Very good. So let's back up a little bit. Nurse clinician, for those that are not as familiar with that role, what does a nurse clinician do?
Nurse clinicians are similar to clinical nurse specialists in a sense that they have a clinical area that they focus on, and then they are resource persons for the units and other units in the hospital that have those types of patients. So in my particular case, those types of patients are everywhere.
Everywhere. And your specialty, psychiatry, mental health, we should mention, we just came out of Mental Health Month. A lot of attention focused on that. You obviously play a very significant role for us here in the hospital,
yes.
In that area.
Yes.
So your home base, as it were, was E2, which is our inpatient mental health unit, but you are somebody who finds himself really all over the hospital.
Everywhere.
We're going to talk about the different things you do in a second. Take us back, though. You said that you, at one point, worked at the Capital District Psychiatric Center, and Albany Med said, hey, we'd love you to work for us.
Yeah, that was a very interesting situation. At the time, I was in academia. I was teaching at a local college. I was on faculty and also weekend charge person in this CDPC crisis unit. And so one day, it was just a normal day being in charge, and somebody who I worked with gave me a piece of paper with a telephone number on it and said, Albany Med wants to talk to you about a job, to which I replied, I have two already. I really don't need a third. And she said, call them. So I called Albany Med, and I spoke to somebody in the A building, I believe, and they said to me, we'd like to talk to you about what we have at Albany Med. This isn't a job interview.
And you were happy with that decision to move over here?
Yeah, they basically laid out what they would like me to do, which was very, very broad, and I couldn't say no.
Well, we're glad you did say yes. And you mentioned the fact that you're in a lot of different places doing a lot of different things. We can't touch on them all.
Yeah.
I'd like to, but we may run out of time.
Right.
But one area that I think I often associate you with is de-escalation.
Yeah.
You are someone who's known to me who educates our staff, who works with clinicians, who works with security on the idea that there are these moments, patients, visitors, there's some situation. You are what I would consider to be an expert in de-escalation. You want to talk a little bit about that?
I de-escalate people, but I also deal with crisis negotiator, and essentially my education from many different places have stacked on that. So I can literally walk into any situation.
Tell me specifically, people often talk about camp training, C-A-M-P. What is camp training?
Okay, so camp training is a de-escalation training, but also with some added nuances that the Office of Mental Health did not have at the time. And we concentrate on self-regulation, co-regulation, and theory of mind, understanding what that other person's going through, their history, their traumas, their current situation, and then getting them to a better place emotionally.
You mentioned that you were over in our Alden March Bioethics Institute earlier today.
Yes.
So you're over there as well.
Yes, I have responsibilities to different parts of the hospital. I have responsibilities to Alden March. I have a philosophy background also, and this morning I was actually teaching in one of their master's levels courses, my little section. So I belong to them as well. I have to go back and continue teaching after this. And I'm a former university teacher, so it's right up my alley.
So academia really is it's who you are.
Academia and clinical.
And clinical.
Both, and I've been on the faculty of Binghamton University, University of New Hampshire. I taught locally in a college. I taught in High Institute for Nursing in Menifee University in Egypt and some other places.
Another aspect of your life that people may not be familiar with, every year on Veterans Day on the internet page, they'll show pictures of members of our workforce who had careers in the military and armed services, and every year the same thing happens. Someone says, is that Charles O'Donnell there in the Army? So you are, in fact, an Army veteran.
Yes, I'm an Army veteran, and I also did work in the Somali Civil War as a civilian, and people get those two confused. I was in the 82nd Airborne Division.
I see your jump wings right there.
Yeah. I initially trained to be an infantryman. I got to the 82nd. They put me in G1, which is the part that runs the division. Then I went down to the infantry. And once I got there, they bounced me around to do all kinds of training. I went to chemical, biological, and nuclear warfare school. I cross-trained with military intelligence and psychological operations. I was pretty much an expert at landmine warfare. I did a lot of different things.
How many jumps did you get in your career?
38 jumps, 3 concussions.
Okay. Any at nighttime?
Most of them.
Most of them at nighttime.
Some like 500 feet.
Yeah.
That low.
So we call that low altitude, low opening.
Yeah, it was very low.
Way low.
Way low, way low. Yeah.
So tell me about the transition from military to mental health.
When I was
Or to nursing.
to nursing, when I was in the Army, I developed a very deep interest in not only the military intelligence aspect, but also the psychological operations and how populations get shaped in propaganda and such like that. So that's been a through line in my education, and it works all the way through to my work in Egypt as well. In healthcare, I'm also familiar with all the nefarious sides of psychological warfare.
And so when you made this transition into healthcare, for you, has that been a good decision? Are you happy working in healthcare now?
Yes, it's been very good, because the same skill set that I had learned in the Army and built upon in my bachelor's, master's, and all my doctorate work, I've turned that into a good tool instead of a different kind of tool.
When I think of you, the thing that often comes to mind is you strike me as somebody, and I've known you experientially to be someone who likes to help people.
Yeah.
That's kind of the core of who you are.
Yeah.
Whether it be in the military or into nursing or now in your special role of crisis, you're someone who likes to help people through a situation and hopefully get to a better place.
Oh yeah, I mean, I've always worked in high stress situations as an infantryman.
Right.
And we had some very bad times, and I was the one who had to make the decisions and keep everybody safe, because I always felt that I wanted to make sure I sent all my troops home to their mom. That was my goal.
That's a great goal. We were talking a little bit before we sat down here. You're someone who likes to spend time outdoors, in nature, hiking, and you said recently you've been doing a lot of reading. What sort of books do you like to read?
I was raised to be like a polymath, which is somebody who has many, many interests, and I've developed expertise in many, many areas. So literally, I must own over 10,000 books. Cost a fortune over the decades. So I'll read through many subjects, and in any given week, I'm spending about 30 hours studying.
Just studying?
Just studying, watching lectures, reading books, everything, medieval philosophy. Some of my roles here, I deal with for example, the chaplains program. So
yes.
I have to buff up my knowledge of comparative religions and such things, so I can be a resource to the students.
And do you find sometimes that the readings that you've done, whether you realize it or not, you pull it into your work here?
Oh yeah, everything wraps either directly or indirectly. Even if I'm reading a novel about people interacting, it's like, oh yes, just like, interacting here.
Very good. Yeah. So what's the future for you look like? What else would you want to do to keep yourself professionally motivated and looking for new opportunities?
Okay, Albany Med is a very unique place, because I can say that every year is like a new job, and it's endless, and there's so much more to do. And I think my regret is that one day I'll have to leave, because I'm not going to live forever. There's many more projects that I'm working on. Like, we're rewriting camp into this new format that's going to take into next year. I want to do some crisis negotiation education for security. There's work with physicians that I want to do, and whatever else the organization asks me to do, I love to meet the challenge and get them what they need.
Well, we appreciate it. I mean, one of the great things about Albany Med Academic Medical Center, every year we get a new group of interns who come in, we get new students who come in, we get new members of our clinical workforce. So there's always an opportunity to educate new individuals, and even those that have been educated. There's new ways of practicing. There's new syllabus or new methods that we have to learn. So you're always part of that education for us.
Oh yeah, there's always new things. I get the new psychiatry residents every year, and I'm a resource for them as well. I'm a resource to everybody and anybody.
Very good.
And I always tell people, never feel like you're bothering me, because my purpose here is to help people flourish.
Very good. Any advice you would give to anybody who's thinking about becoming a nurse clinician?
Well, if you're going to do psychiatric or psychological type work, you need to know yourself as best you can, and that's a lifelong process, and your education never ends, and everybody will teach you something. Everybody will. From the smartest people on down to the newest baby, they will teach you something, and be open to that.
I would imagine in the type of work that you do and the situations you have to deal with, some days can be more stressful than others. Talk first of all, as an individual, how do you deal with those ups and downs?
Most days are good, but every day is emotionally taxing. And sometimes I deal with some incredibly stressful situations with families and staff, very, very difficult, and I'm very affected by it emotionally. And I'm present for these individuals. And then I go home, and then I have my space. I've got a very pretty space with my library, and I sit and read or listen to music there and process what happened and how I feel about it. So it's pretty well a process I've figured out for myself, and it works very well. But it's hard to put into words. As you know, as a physician, you deal with these incredible situations, and you have to recharge somehow.
So is that the advice to somebody who has similar situations where they may have days that are up or down, is find whatever way you need to recharge, whether it be hiking, reading, gardening,
whatever the self-soothing, self-education, things in a good way, and also to have good people to relate to. I've had the great fortune of having wonderful mentors that I used to be able to call up and talk to, and still do actually. One of my mentors was the Minister of Health of Yukon Province, Canada, who gave me great advice, and people around here as well, physicians, nurses, friends.
I often talk about the importance of having mentors, and I certainly have been the beneficiary of having great mentors. And in return, what I like to try to commit to is also finding an opportunity to be a mentor myself. I suspect that you're probably looking for opportunities to be a mentor to others here at Albany Med.
Actually, since I've come here, I've had a series of people who I've mentored, and then they go on and go to different places and get doctorates. And
that must make you very proud.
It does, because I'm a tiny piece of their journey. And then they call me up every once in a while, let me know how they're doing. I'm like, 0.01% of their success. Yay.
Well, you're a part of their success. Yeah, that's important. And maybe what you can do is you can send this video to them.
Okay.
And let them know that you're doing well and that we're still very much appreciative of the fact that you're staying here with us.
Yes.
These videos get watched by several hundred people every time. So there's going to be people watching this. If there's one or two individuals who are watching this who feel like you're someone who they'd like to talk to, we know we have lots of great resources here. We have Employee Assistance Program, EAP. We have Pastoral Care. You yourself, you're a resource. People can reach out to you, Charles, if they need to?
Yes, people can reach out to me anytime they want to. And if they're off-shift people, they can get a message to me, and I can come in and visit with them. But remember, I'm a colleague. I am not a psychotherapist.
No, but you can help them, and then you can also point them in the direction.
Yes.
And you know those other resources that we have here. But more often than not, you're someone who's willing to listen, you're willing to help, and you're willing to point people in the direction that they need to go.
And I do a lot of guiding to resources often.
Charles O'Donnell, nurse clinician, polymath, Army veteran, educator for our entire workforce.
Yes.
We really are lucky to have you here. I appreciate you spending some time with us, and thank you for everything you do here.
Thank you very much, sir. Appreciate it.
Very good.